Welcome back. Now, talks about the COVID-19 vaccine has been making rounds through the world, and particularly in the United States and the United Kingdom, where for the past few weeks, vaccines have begun. Dr. Monalisa Muchatuta is an emergency medicine specialist in the State University New York Hospital in Brooklyn, New York State. She's one of the first lucky few who got an early chance to be vaccinated against COVID-19. This was her immediate reaction after taking the vaccine.
So, hi everybody. Just got my coronavirus vaccine, as you can tell from this beautiful I got vaccinated sticker. I got the Pfizer vaccine at my job today. I feel extremely privileged and a strong sense of relief that this vaccine is finally here. I know there are a lot of people that felt or are still feeling a bit of trepidation around getting this vaccine, but I'll tell you that I feel relief. COVID has been is scary. What we've seen in the hospitals was scary. And this decision was an easy decision for me because after they proved to me that the side effect profile and 95% benefit for this vaccine, there was no choice for me but to take it. And I'm extremely happy and extremely grateful to have gotten it. I feel good. I am one of those doctors that's afraid of needles. So there was a little bit of drama with just getting the needle in my arm. But like I said, if I could get it in my eye, I would have, because this was a no-brainer. I'm happy to talk to anybody that's still worried. Text me, call me, email me, and we'll talk more. I feel good. Talk to you soon. Christmas came early, you guys. I'm just overwhelmed with happiness and relief.
Dr. Monalisa Muchatuta now joins us via telephone to talk to us about COVID-19 and her experience thereof. Good morning, Doctor, and welcome to Good Morning Namibia.
Good morning or evening. Thank you for having me.
Very well. It's good to be talking to you. Now, you are a medical doctor in one of the countries where death and infection rates is among the world's high. Talk to us about your experience during these times.
Oh my gosh, I'm so grateful that COVID hasn't really been as terrible in Africa as it was here. I mean, it was disastrous. You felt extremely useless when you're confronted with patients that actually needed help. You know, everything that you ever learned in medicine, everything you ever learned in your training, you tried to use, and sometimes it just wouldn't work. You know, patients just decompensated in front of us, and we just didn't know what to do. We've since learned a lot, but I've never seen anything like this. Even more seasoned providers, like older doctors that I've worked with and learned from, everybody was just like in shock. So, it was pretty devastating for us.
I can imagine. Now, you work in emergency medicine, and what have been the most scariest moment during these times of the pandemic?
Everybody sort of felt like beginning of the pandemic that, young people were always going to be safer. And I think for me, the scariest moments was when you have a really young patient that, in my opinion, looked like me, was probably not that far from my age group. And they were dying from this illness that, they probably never imagined that they would have to suffer from, A patient 1 second walks in and says, "Doc, I can't breathe." And then maybe 5 minutes later, I have to put a breathing tube down their throat for them to breathe. So that's pretty scary. We don't like doing that.
Of course, definitely. Now, you recently became one of the lucky few to receive the vaccine this week. What does this moment mean for you?
Oh, my gosh. I think even from my video that I think you guys just played, relief was the first feeling. You just all of a sudden just feel like we've been so afraid and so nervous. We're begging for scientists to help. We're begging for leaders to help us, for people to do their best, with the social distancing and the mask, and all of a sudden to have hope that maybe this thing is coming to an end. So relief and hope were my strongest feelings.
But one would think, why was it necessary for the medical practitioners to actually be prioritized for the vaccine this time around?
You guys remember watching videos from us also, and the depths of it when it first started, when we had nothing. We had no mask. We had no gloves. And sometimes these patients come and a patient has a headache with symptoms that look like stroke or chest pain, and it turned out to be COVID. And I think the reason why we're being prioritized is so that whatever happens, you always have healthy physicians to take care of you. I mean, I feel lucky. I feel privileged. I'm healthier. I survived from COVID and feel like, maybe I will be okay.
Yeah.
But because the professionals are saying take it, I think it's the right thing to do so that we can always be here for all the patients that will need us while we're waiting for the vaccine to be rolled out to everybody.
And let's talk about this emergence of this vaccine. What does it mean to you and other healthcare workers, as well as the community healthcare workers in general?
I mean, I think for now there's a lot of discrepancy. I mean, the healthcare workers, especially doctors, we have been waiting for this to come. I mean, you had to build walls around us to jump over for us to go and get that vaccine. But I also understand that the communities that we work in, especially in the Black community, African and immigrant communities, a lot of people are very worried and skeptical. There's a lot of misinformation in the world about this vaccine. And so what it means for me as a healthcare worker is that we have our work cut out for us to kind of encourage people to keep doing the right thing, learn the correct information, and sort of put our hats on to work together to abate this misinformation that's going to prevent people from getting the vaccine.
Yeah,
I think at the end of the day, it's everyone's choice, but I think we need to inform people about what's available to them.
Now, there were recent media reports that it would take 4 to 5 years to cover at least 60% of the African population with a vaccine. As an American of African origin, what do you say around this?
It's frustrating, but I don't think this is new, right? This is not a new thing that has happened to our continent. However, I don't think it's such a terrible thing because, especially considering the distrust or worry that a lot of people have around this vaccine, it might not be a bad thing for a little bit more research to occur and at least encourage more people to feel a little bit more empowered by the time they get it. Honestly, I think, this vaccine, they did the work that they were supposed to do and is ready to go as is for most people. But I think the timeline might probably be faster. I think a lot of the times they pad the time just so it doesn't seem like things are working. But I'm pretty sure it's going to come I'm hopeful that it's going to come a little faster.
Now, let's talk about misinformation and what will be fear among the people resisting the vaccine. From your experience, and let's just cancel this misinformation right now, is it true that you sort of, this vaccine sort of knocks you out or it makes your heart beat faster? What's true about those, some of those information?
Right. Well, good questions. Well, I had the vaccine now close to 36 hours, and I'll tell you that I wasn't knocked out once. My heart is still beating just fine.
Your skin is not peeling off?
So I can advocate for that.
Yeah.
Now, there are a lot of side effects that are available for all vaccines. This isn't new, right?
Yeah.
So even all the measles, all the smallpox vaccines that we take, there's fevers, there's things that happen, body aches, and et cetera. But this particular vaccine, specifically the Pfizer one that's been rolled out, there are no serious side effects that are going to hit the largest populations like that.
Yeah.
And I think people just need to talk to their doctors and their health professionals before they take it and make sure they know what they're getting into.
Yeah. And were there other medical officers where you stay that also took it, and the community at large? Are people receiving this vaccine well?
So far, for us, it's only healthcare workers that are getting this vaccine for now. In the UK, which is using a different vaccine, the AstraZeneca, that's where they started giving it to older populations. And as far as my research as of earlier today, there were only 2 allergic reactions within New York City since the rollout started. And that was only allergic reactions, which both patients are alive. So, I mean, I am afraid of COVID. COVID kills. Yeah. And if the adverse effects are things that we can control medically, I still think the benefits are still there. So nobody has died in the studies. Nobody died of the vaccine. And so, side effects are expected with anything. You can take paracetamol and get a side effect. As long as it's something we can manage medically, I think it's still definitely worth it. And we've only had 2 of those so far in the last 24 hours for us.
And that's for that's allergic reactions. Let's talk about the rollout of the vaccine. How are people being vaccinated? Do they go to the hospitals, the state hospitals, and they get vaccinated, or what is the process like?
So for now, our process is we have the highest risk healthcare workers within the hospital, and the hospital identifies. So for me as an emergency medicine specialist, all of the people in our department, because this is where you first walk in, and we don't know what a patient has when they walk in. So everyone in the department is allowed, if you are offered the vaccine, and it's your decision to take it or not. So it's not only doctors, our nurses are getting it, our secretaries are getting it, even the cleaning person that works within our department, they're high risk as well because they come in contact with their patients.
Correct.
So everyone gets it within the high risk criteria, or high risk areas anyway.
Okay, Dr. Muchatuta, any final words from you this morning?
Oh my goodness, this is like the path to the end of this terrible year that we've been in. I just want to encourage everybody to keep wearing your mask, keep social distancing. The vaccine has 2 doses, so just because you've got the first dose doesn't mean you're immune. You definitely have to get the second dose, and we have to make sure that everybody is sticking with the guidelines until everybody is vaccinated. That's the only way that this pandemic is going to end. And I just encourage everybody to just keep wearing their masks and social distancing.
Great. Thank you so much, Doctor. It's lovely speaking to you.
Thank you so much for having me.
Great. Dr. Monalisa Muchatuta, medical officer at Sunny Down State Hospital. She just got her vaccine, that is less than 36 hours ago. She was telling us about the experience and how the rollout of the vaccine is going in the UK, where it's given first to the emergency healthcare workers who are the first responders of patients coming into the hospitals. Talking about no side effects, and among all those who were vaccinated, only 2 cases of allergic reactions. When